We're told that the factory operates in the fish processing industry in the enclave of the Tema industrial area. And then the question will be, have we been able to do the contact tracing for these individual numbered cases? And what could be the implications on the next round of numbers or cases that are reported? One of the concerns that had been raised over the last a day or two following the last address by the president was the question of why we did not have the daily reporting or posting of cases on the Ghana Health Service COVID-19 site. Hitherto, you would know that before we had the 3 or 4 day updates, we had daily updates on the site. But look, Mamavi, we have to go live to the ministry for information to get the last of the latest we have.
Speaking now is the Information Minister, Kojo Ponkroma.
So that you can also deal with for Parliament currently. But as we start, let me outline the key subjects that we are dealing with today. First, we'll get a quick update on our case count and case management from the Ghana Health Service. This morning, we, in addition to the general picture, want to spend some more time on what we call a district-based analysis of the COVID-19 infections in Ghana. A district-based analysis of the COVID-19 infections in Ghana. The reason is that we want to, yes, respond to requests for some more data, but we also want to provide information, particularly for those of us who live within these districts, that as we generally talk about people taking precautions, you also need to be extra careful in these districts as well. We will spend some time doing an analysis of Ghana's mortality data. There have been questions about that. Dr. Bedusa Kodie will help us with some analysis of the mortality data, particularly the comorbidities, which we believe have contributed to some of the unfortunate deaths that we have. And then I will give you an update on government's priorities post the cabinet retreat. So I want to start off with a quick comment on International Nurses Day. Just before we take that first presentation, or perhaps even before we do that, let me start by sharing with you our little demonstration on the wearing and the use of the face masks, just for a couple of minutes, and then we will deal with International Nurses Day, and then subsequently our first brief.
To consider. Hi, here are some preventive measures to consider as we fight coronavirus. First, wash your hands with soap under running water or use alcohol-based hand sanitizer. Place the mask over the bridge of your nose. Fit the mask tightly but comfortably against the side of your face. Place the elastic bands behind your ears or tie the rope around your head. Stretch the mask downwards to cover your chin. Allow for breathing without restriction. Avoid touching the mask while using it. If you do, keep your hands with alcohol-based hand sanitizer or wash your hands with soap under running water. Replace the mask with a new one as soon as it is wet and wash after each use. Remember, to offer effective protection against COVID-19, masks must be used in combination with frequent hand washing with soap under running water, use of alcohol-based hand sanitizer, and physical distancing. Thank you.
That is just a quick demonstration on the use of the face mask. It will be also made available in various languages on your televisions and on our social platforms. But as we start, today the 12th of May, is International Nurses Day. It's a day to observe the contributions that nurses make to society. This year, the commemoration of the day comes at a time when the role of the nurse needs no further highlighting. As you are aware, we are in the midst of a pandemic, and the nurse is an instrumental figure in this fight. From contact tracing, triaging at hospitals, to care for the sick and follow-up even on those who have recovered, the Ghanaian nurse has been a strong soldier in this battle. We dedicate today's briefing to the celebration of the thousands of nurses nationwide who continue to serve as part of the frontline health workers in our battle against COVID-19. Your efforts, your sacrifice, and your dedication is immeasurable. The President, the government of Ghana, and the people of Ghana very much appreciate your hard work and will continue to provide the support that we can to make your burden lighter. The theme for this year's commemoration is Nursing the World to Health. And it is our expectation that as you continue with your hard work, you will support the other frontline health workers to nurse the Ghanaian population and the few who have tested positive to health. I'm going to ask colleagues who are here to rise and to join us for the next 30 seconds to applaud in particular. While generally we celebrate our frontline health workers, today being the day on which we celebrate International Nursing Day, to join us for the next 30 seconds to give a big round of applause to our nurses across the country who are supporting this effort. We celebrate their hard work, we congratulate them, and we ask them to keep up the faith. As I mentioned earlier, the President, the government, and the people of Ghana will continue to provide the kind of support that we can at this point in time. We thank you, and you may resume your seats. We want to start with a quick update on our case count and case management as at now, paying particular attention to a district-based analysis of the COVID-19 infections in Ghana. Dr. Patrick Abuaje of the Ghana Health Service, Director General, please join me.
Good morning. And good morning, colleagues, Honorable Minister of Education, of Information. Today, as was mentioned, I'll do the usual update of our figures and where we are, and then do some extra work on our district distribution so that people get to know where the hotspots are and how to be careful of where and what we do. So far, we have recorded, as at this morning, working from the data from the 11th of May, 427 new cases, bringing our total to about bringing our total to 5,127, just a mixed up. The total new cases from the 9th was 277, 160 for the 10th, and we have 427 new cases for yesterday. Out of that, 272 of them has come from Obuasi Township alone. 1,474 has come from routine surveillance, and then 3,538 has come from the enhanced surveillance, which we continue to do. Our total recoveries, as of yesterday, is 494, and we have about 130 awaiting their second negative test, which will increase the number of recoveries. That brings our active case search, active cases, to 4,611. And as I mentioned the last time, the 4,000 active cases are those that are still in management. Either they are in isolation, either in a specialized isolation center, isolation at home, or they are in our facilities being cared for. 4,006 and 6 of them are currently responding to treatment, and 5 are critically ill at our various health centers, mainly in Accra. I will just go into the core cases as we have them by region. Greater Accra is recording a total of 3,981, an increase of 89, and I'll get into more details when we get to the district levels. Ashanti has moved from 355 to 662 with a new case of 307. Central region had an increase of 27, bringing their total to 154. Western region had 3 new cases, so they are now 52. Eastern had no new case, so they are still at 99. Upper West had no new case. Upper East had no new case. OT had no new case. And the rest of the region, that's Western, Northeast, Northern, and Bono, had no new cases as of yesterday. So the main places where we had changes were Greater Accra, Ashanti mainly, and Central and Western regions. Of the 89 new cases in Greater Accra, 40 came from routine surveillance and 49 from enhanced contact tracing. So far, 26 districts have been affected in Greater Accra. The current hotspot, that is where we really have new cases, are Tema Metro, which I will get to again with the house heat maps, Korle Klote, Accra Metro, and Pong Katamanso. Now, so if you take a look at the next slide, which is the heat maps, you can see where the reds are. Tema Metro has become a major spot where we need to take a crucial look at. And the Tema cases, the 533 that came up last 3 or so days, we've had to do a retesting of those because they've done about 2 weeks. Currently, about 187 of that number has been tested. 50 of that number has turned negative, and we are hoping that by the next, we do the next 2 batches, we'll still have a lot of recoveries out of that group. You can also see that Accra Metro is deeply red. So what you have is Accra Metro, mainly Korle Klote, Ablekuma West still remains a place where we had a number of cases. Okaiki West North has a lot of cases. And you can see that the rest of the Greater Accra are mildly, moderately inflamed. So you have the Gan Central Municipal. You have also Adenta area also showing some signs that these are areas where we have recorded a significant number of cases of late. But as you can see, most of them have now recorded relatively low figures. So Shautuku only reported 1. Ashaman 1, so Ashaman cases are coming down. But you can see that Accra Metro has also dropped to 10, Korle Klote 27, and Pong Katamanso 24. So this is what is happening in Greater Accra, and those 4 areas are the core hotspots, but also tells you that where the virus has been mainly. You can do the next slide. That gives you more details of the Ghana Township. That we may see some of the communities that are really affected. If you come to the Accra Metro, you can see the Korle Klote is quite above Accra Metro. Korle Klote is still very deep. Ayahuasca East Municipal is still quite deeper. So these are available for us to share to see that these are where the real hotspots are in Accra. Tema has become a major place where we are currently doing a lot of contact tracing and follow-up to be able to control the cases. The next slide also gives you further breakdown into where we are in terms of the details That gives just further details about the metropolis, where we have Tema, Newtown area, Asama, and then Ashaman still remaining a key. Well, the next major place is Ashanti region, where we have recorded 307 new cases. And out of that, about 272 has come from Obuasi alone. The areas affected in Obuasi are the Central Market, Wabaso, and Asonkori area. And a few miners has also been reported with cases. This is a case of the Central Market was a case of a couple who were positive, unknown, and had been trading and working with people for the past 2 weeks, and we found their immediate contacts, 17 of their immediate contacts being positive, and that has led to the spread in the market. As we speak now, the market has been closed so that contact tracing and cleaning and disinfection will take place. Currently, Kumasi reported only 5 cases. Oforikro is another main area where we've recorded 25 cases, and in Kawe, 5. So now Kumasi Metro cases are coming down. Obuasi is going up, and in Kawe. So that tells us that some of the dynamics of the large groupings were very congested. The Central Market and the Lorry Park is a very congested market. So any case there can lead to a quick flare-up. And so currently, we have a team of about 40 teams of contact treaters trying to quickly mop up the cases and isolate. We currently have put about 45 of them in isolation. The rest are home isolation. Today, a significant number of those who cannot self-isolate will be moved to an identified isolation center this morning. So if you look at the maps in Kumasi, the Ashanti region, you can see that in the Kumasi Metro, it is more at the center of Old Tafo, Oforikro, Asukwa, and the Kumasi municipality and metropolis itself, where we had a significant number of cases. But the peripheral areas remain quite in isolated cases. That has been. So this is what shows you particularly in Kumasi. The next one extends for you to see the Obuasi, where we have the Obuasi municipal, where the majority of the cases are in Obuasi is where you have them. And then also have the Adansia Sukwa, where you also have a few cases springing up there. But these are all interlinked districts where we have people living and moving between them. So Obuasi remain now probably the hottest spots where we have a massive case search and identification going on. The next slide also gives you further details of what I've already explained. In Kumasi, you see all those areas that are there, Swami, Old South, Old Tafo. These are all areas where we have Kwadasu Municipal, where we are reporting some cases, and that of Oforikro is more detailed. And in further, you can also see in a closer view the communities that are significantly affected in the areas of Ashanti. So you have mainly the hottest areas will remain Kumasi Metro, Kwadasu, Swami, Oforikro, and Aboso. These are where we are having the large number of cases that we need to look at that. These are all additional slides that shows the details of where the cases are, including the communities where we are having to, and we are imploring all to take note of this and make the necessary adjustment to their lifestyle to be able to reduce spread. Workplace has become another important area, and as you can see, all the new hotspots are coming from hot workplaces, and so we need to ensure that what we do in our workplaces, creating the necessary space, hygienic environment is extremely important. Social distancing, even within the workplace, is extremely important if you are going to be able to contain. If we didn't have these hotspots, the number of cases, as you can see, would have significantly dropped. So the next stage of our fight will be working more on hot spaces and identifying these risk areas, and also creating the necessary protocols and enforcing some strict adherence. When it comes to Volta region, we don't have maps there, but the hottest spots in Volta region have been Sekretu South with 21 cases, Kpando has 1, Hohoi 7, and Ho has 4 cases. The new cases came from routine surveillance in Ho when someone presented with breathlessness, known hypertensive, and hypertensive. So that's just the only new case that came up. But overall, this is where the most of their cases are in these 4 key districts of Volta region. Of the 27 cases in Central region, the affected districts are KEA, where there's a major enhanced surveillance going on to be able to identify and also contain. We have Cape Coast, Ejumakun, and Ewim. Currently, about 148 fishermen were under quarantine in Mori. They have completed their 14-day follow-up. 3 tested positive, and they are currently in our isolation center awaiting recovery. Honourable Minister, this is what I have. Thank you very much.
Dr. Abadi, thank you. We will at some point go over the district case count once again. A couple of things. The Obuasi Market incident, if you add that to the Tema factory incident, as you mentioned, it gives rise to renewed calls for workplace vigilance. That for the workplaces that are being opened up or have been opened up again, we need to be extra vigilant and ensure that the preventive etiquette and the workplace management strategies, such as ensuring that simple things like door knobs, stair rails, etc., are continuously sterilized. We really need to do that to ensure that protection is also upped in these places. And then for the districts that were described as the hotspots, we'll go through that list again. What it means is that those of us who are living in these districts, we also need to be extra precautious. If your district is not part of these hotspot districts, it doesn't mean you're out of the woods. You also need to take the necessary precautions, because you don't know who is out of these districts, who you are engaging with on a daily basis. Now, we've also received a lot of requests to provide some more details on the mortality data. Dr. Bedu Sarkodie, who is head of public health at the Ghana Health Service, and his team have been working on doing some analysis on the mortality data. So let me invite you to take us through the analysis on the mortality data as we have it currently.
Thank you very much, Honorable Minister. Distinguished Ghanaians, I have the responsibility to give updates on the death situation, the COVID-19 associated deaths in the country. The Director General mentioned earlier that we have a total of 5,127 confirmed cases of COVID-19 associated, confirmed cases of COVID-19 in the country. This is as at the 10th of May, 2020. Among the cases, 22 have died. This brings to a case fatality of 0.43%. The case fatality rate of 0.43%. Case fatality rate is an attribute of two major functions. One, the quality of care, and the other one, the second part, is how early do people report with the condition when they have it. Putting it all together and comparing to what is happening in other countries, the case fatality rate for Ghana is among the best globally. The age range for the deaths is from 9 years to 82 years. The youngest is 9-year-old, and the oldest 82 years. The mean age is 55.5 years, and the median age 58 years. I've mentioned the mean and median, those that are interested very much in statistics. The median age for the mean age for males is 52.4, compared with 58.1 for females. Clearly, there is clear preponderance of the deaths for the males, and the death rate proportion, or the ratio of the male to female, is 2.14 is to 1.00. Males are also having highest number of deaths in all age groups, with the exception of 25 to 34 years, where the death rate is the same. There are charts for this later. You can share with you as appropriate. Now, we've been mentioning all along that most of the deaths, there are associated comorbidities. We have done some analysis of this, and out of the 22 deaths that we have recorded, 90.9%, close to 91%, have comorbidity. You come to the details of the comorbidity later, and 9.1% don't have any comorbidity. If you just do a bit of breakdown, out of the 22, only 2 had no comorbidity. That comes up to the 9.1%. 13.6 had 1 comorbidity. 63.6 had 2 comorbid conditions, and 13.6 had 3 or more comorbid conditions. Let's remember that one person can have more than 1 comorbid condition at a time. When it comes to the regional distribution of the deaths, Greater Accra has the highest number of deaths, and Greater Accra contributes to 68.2% of the total number of deaths, followed by Ashanti region, 18.2%. Next is Upper East, 9.1%, and Northeast region, 4.5%. With the various comorbid conditions, hypertension is the greatest, is the highest in number, and contributes up to 72.7% of the various comorbid conditions, followed by diabetes mellitus, which is 44.5%, chronic liver disease, 9.1%, asthma, 9.1%, obesity, 9.1%, stroke, 4.5%, prostatic conditions, 4.5%, acute kidney injury, 4.5%, interstitial pulmonary disease, IPD 4.5, and congestive heart failure 4.5. So clearly, these are the situation of fatality among the COVID-19 associated deaths for the country. I mentioned COVID-19 associated deaths because causality has not been established. And whether it was the COVID or this comorbid condition that resulted in death, we have not done autopsy in these conditions, and we cannot establish that yet. Thank you very much, Honorable Minister.
There's a part I need you to reiterate for us. What do you mean when you say this big word, comorbidities? What does the word comorbidity actually mean? If you can just help us by reiterating what you mean when you say comorbidities.
Thank you once again, Honorable Minister. We have 22 deaths associated with COVID-19 disease. And indeed, the assumption is that with this association, people think that automatically the cause of death is COVID-19. There are other conditions that these people had the time that they went to the hospital. The condition became severe and died. Indeed, for some of them, they spent less than 24 hours within the hospital whilst being investigated. It came to light that with this severe condition, people in the terminal stage of life and short of breath, let's also think about COVID and take sample for testing. And indeed, for quite a significant number, the report came several days or a few days after the person has died. So you say comorbid, the person was confirmed as a COVID-19 case because there were reason to take sample. Sample was taken, sent to the lab, and then came out to be positive. These people had other severe health conditions that equally or more potentially can kill than the COVID disease. So that is what we call comorbidity. The person is a confirmed case of COVID-19. In furtherance, there are other disease conditions that also very life-threatening and even more life-threatening than the COVID. Because the two are related, we think that we cannot exonerate COVID as cause of death, but then the other conditions also, we cannot exonerate that. So those conditions are associated, and that's why I'll be using those words very carefully, that COVID-19 associated deaths. People always think that COVID-19 killed such people. It could be the other way out. And as much as possible, the best way to get that done is to do autopsy for the pathologist to come out clearly as the cause of death. But most of this work has not been done. Whether you do it or not is yet to decide, because it also has implications with regards to spread. We can do it if we take the necessary precautions for the pathologist, but then we need to also tread cautiously as we are handling dangerous pathogen and then going in for mass autopsy examinations. So comorbid means that these disease conditions are associated with the COVID-19, and it's difficult to say which one indeed was the cause of death. And when they are present, they worsen the prognosis or the outcome of the COVID-19. Even if the COVID-19 should be the cause of death, the presence of such conditions makes it more risky and then more life-threatening. The likelihood and the chance for that person succumbing to the disease is high. Thank you very much, Honorable Minister.
Thank you. Yes, sir, you can. Thank you very much, sir, for that education on comorbidity. And another key point he makes is that he's talking of an associative relationship, not a causal or a causative relationship. And I think for those who studied statistics, you may also want to highlight that a bit more. But thanks for that education. I want you to quickly put back up on the screen Dr. Patrick Aboagye's presentation, the first 2 slides. There were some things he went through quickly, but I need us to reiterate it. For example, the total number of samples tested so far, as at close of business yesterday, which is the 11th May, total number of samples tested so far is 161,203. And now the positives sit at 5,127. Now, I noticed, just as I was on the phone, that one of the new networks is reporting that our case count is now 4,611. No, it's not the case. The case count is 5,127. The case count refers to all persons who have ever tested positive. It doesn't matter whether they have recovered or whether they have unfortunately passed on or whether they are still active. But the case count refers to everybody who has ever tested positive. That is the 5,127 that often people see and get scared. But the Ghana Health Service is also providing some more data on what they call active cases. That is case count minus those who have recovered, minus those who unfortunately have passed on. So those who currently are positive, that is the 4,611 active cases. So for the networks that are already reporting that our case count has dropped to 4,600, no, that's not correct. The case count is gone up, is 5,127, but the active cases, that is when you take out those who have recovered and those who have unfortunately passed on, that's how come you come to 4,611. We have 494 recoveries. That's one point I just want to reiterate. Point number 2 I want to reiterate is that we have had between the 4,700 and the 5,127, we have had a jump of 427. 89 of them are from the Greater Accra region. He highlighted what he called hotspots. I want to go through the whole list. 89 are from the Greater Accra region. That 89, this is the breakdown. Kole Klote, 27. Katamanso, 24 new cases. Accra Metro, 10 new cases. Adenta, 4 new cases. Ganorth, 4 new cases. La NMMA, that's La Nkwantanan Municipal Assembly, 4 new cases. Tema West, 4 new cases. Okankwe North, 3 new cases. Ablekuma West, 3 new cases. La Dadekotopon, 2 new cases. Gan Central, 2 new cases. Ashaman, 1. Shai Osudoku, 1. This is in addition to the 3,892 cases that were already in the Greater Accra region from different places. So we are providing this breakdown and stressing on this, that people have to take extra care, particularly in some of these areas that we are speaking about this morning. Don't take it for granted. Take this seriously, take extra care. Eastern region has recorded no new case beyond the 99 that already exist. Central region, 27 new cases. Cape Coast alone was 12, Ejumakun was 1, Ewim was 1, Elmina was 3, Abrim Agona was 1, KEA was 6, Bar Salvation Army headquarters area was about another 3. That is not exactly a district, but it was described as such, so maybe we'll have to get it in district. Western region, 3 new cases from the Sekondi Takrady Metropolitan Assembly. Upper West, no new case. Volta, 1 new case in Ho. Ashanti, 307 new cases, out of which 272 is coming from Obuasi. And for Obuasi, a good chunk of it is being traced to the central market, where a couple were positive and through their interactions with others have passed it on. So again, we make the point that we have to take extra care, particularly in the workplaces and markets. So our mothers, to our sisters out there in the market, some of who say when they wear the mask they can't breathe or it's not comfortable, you need to take these precautions to protect your very lives. And then I think that will make up the difference of 427. So that's just a quick update on that one. We're going to take questions shortly. Today's brief is a pretty simple one. Before we do that, though, let me give you a quick update from the cabinet retreat that we mentioned on Thursday. We're heading for. The president mentioned that he had chaired the retreat and headlined a few of the things. Now, at the end of the past week, President Akufo-Addo led a cabinet retreat to examine the impact of COVID-19 so far on the various sectors of governance. This follows initial estimates presented by the Minister responsible for finance that Ghana's projected growth was to take a hit from the initial about 6% projection down to anywhere between 1.5 and 2%. We're also going to take a hit on the macro-fiscal position, and therefore we need to make some adjustments. Now, all ministers had an opportunity to present an update on how the COVID-19 was affecting their sectors and what it would take to recover from the slowdown occasioned by the pandemic. After deliberations, the government decided as follows. Among other things, the finance minister is to ensure that the macro-fiscal slippages occasioned by the pandemic are reduced to the barest minimum. It has become obvious, however, that this year's deficit will exceed the 5% of GDP that we have all been trying to work towards. It's important to note, however, that this slippage is as a result of the massive cuts in national revenues due to the global economic slowdown and reduction in trade, and the need to expand some expenditure items to help contain the situation. And that is why this slippage beyond the 5% that we've always tried to keep within is going to happen. Nonetheless, the Minister for Finance is working to ensure that it is contained to the barest minimum overrun. Number two, the Minister for Finance has also been tasked to put together a recovery program and submit same to the nation through Parliament after prior approval of Cabinet. The program is to outline how fiscal expansion can assist specific sectors of the economy to achieve a rebound. Number three, despite the expected hits across all sectors, priority is to be maintained on the following sectors. Number one, health. It is our biggest priority now. In addition to health, other areas will have priority maintained in their sectors: roads, education, food and agriculture, social protection, import substitution and industrial growth, as well as security. Now, I want to make a side note on something else that government has taken note of. This is not exactly a decision from the retreat, but it's something else that government has taken note of. Government takes note of commentary suggesting that some possible governance arrangements can be appropriate should it become impossible to hold elections in December. But the government does not contemplate any justifiable reason to seek to extend its first-term constitutional mandate with the virus as an excuse without a safe, free, and fair election. The government is of the view that instead of contemplating measures that are not envisaged in the Constitution, our best energies, our innovation, our creativity should be invested in exploring how a country like ours can have safe, free, and fair elections. If countries like South Korea did it around the 15th of April, Mali did it on the 29th of March, and I think 19th of April, if Ivory Coast and Burundi and America and Serbia are all exploring how to do this, Ghana should also invest its energies in exploring how to do so, and to do so successfully. Now, the last point, while restrictions on mass gatherings and restrictions on entry and exit into and out of Ghana have been maintained until the 31st of May, government is engaging with stakeholders to examine what safety measures may be effective in a post-restriction era. This is with the objective of ensuring that some sense of normalcy can be achieved while at the same time protecting the population. It is important to think ahead in these times, even while we maintain the restrictions currently. I thank you for your attention. May I ask my colleagues to mount up the microphone, and the first three persons who have questions, please step forward with your questions. If there are none to, we will call it an early morning. Do we have a third taker? Or these are the only two questions for the morning? Yes, Komla, let's start with you.
Thank you very much. My name is Komla. I do my work with JoyNews. A couple of questions, actually, but I'll try and make it snappy. So, the President mentioned that there were some incentives and allowances for frontline health workers. It doesn't appear that there's a clear demarcation of a criteria of who qualifies to benefit from this. I say this because only on Sunday we had someone sending a text into a show the minister was on that he drives the contact tracers around, to carry out the activities, but it's not too clear if he falls in the category of frontline health workers. So the Ghana Health Service Director General, you'd have to help us with this question. And also the environmental workers, they say they are those who supervise the disposal of people who die from COVID-related ailments, but they have been left out of this computation of frontline workers. Only yesterday, a colleague of mine from the Ashanti region, Kumasi, filed a report where they had a press conference raising these concerns. They talk about the fact that they do not even have PPEs to work with. So I don't know if you want to address that. And the minister also gave an update the other time that they were computing data on those Ghanaians who are stranded outside who want to come in. I don't know where we are with that and how soon we will have a decision on this. Thank you.
Yes, sir. Do we have any other takers for questions? Because we want to be pretty snappy. Yes, sir. Go ahead.
Yes, good morning. My name is Selom Amenya. I work with TV3. So about 3 weeks ago, the president indicated that they were going to equip some gene experts laboratories across the country to aid in testing. I want to get an update on that. We also found out from the Ghana Association of Medical Laboratory Scientists that checks have revealed that no contract has been given for cartridges that will be used to be purchased. We want to know what...
Can we take that question again? No, so the Ghana Association of
Medical Laboratory Scientists.
Mm-hmm.
They claim that their checks have revealed that no contract has been given for cartridges that will be used in these laboratories to be procured. Yeah.
Cartridges that will be used in their laboratories?
No, in the gene expert laboratories that the president spoke on.
Okay, so, I honestly don't understand the question. Do you understand the question, sir? You do? Okay.
Yes. Right. So, and apart from that too, the TUC has commented that the 600 million stimulus package they think is not enough. Is government thinking of adding up?
Yeah.
And we're also told that the banking sector is also one sector that will be hit in with regard to unemployment. We want to know that since the taxpayers' money was used to help some of these banks and pay off their debts and the rest, we want to know what's the plan for these people working in the banking sector.
Thank you. Colleagues, are these the only questions we have for the morning? Then I move to the press pool platform. Are these the only questions we have? Then let me quickly go to the press pool platform so that we can take the questions once and for all.
So this is a question from the BBC reporter in Ghana. On the 30th of April, which is just 12 days ago, Ghana performed first 12 autopsies on COVID-19 bodies. Do we have the results ready, and how has that helped to change our clinical treatment of cases?
Okay.
Is the Ghana Health Service worried about the low recovery rate in Ghana as compared to other ECOWAS countries? And the last one, how true are reports that some of the people who were being managed under home management cannot be traced? Thank you.
Okay, thank you. So those are the only questions. Let me go over them and then we'll take answers. Have we agreed on a criteria for who is a frontline health worker? Is that criteria well known, and how do we intend to communicate it across the various categories of health workers so that they are at home? Because we have drivers and environmental health workers who are wondering whether or not they are part. There's a question about, do we have an update on the additional labs that the president mentioned were going to be added? And I'll tie in Selom's next question to that. There are some of the lab operators who say that contracts have not been given for purchase of cassettes or so. So you may want to tie those in. There's a question from the BBC about earlier reports that we were conducting autopsies. Can you confirm that? Have those autopsies been done? What did it say, especially as we talk about morbidity issues? There's also another question about whether or not you are worried about what appears to be a low recovery rate in Ghana as compared to other countries. And while at that, if you want to educate us on how different countries are arriving at what they call recovery, it may be good to contextualize that one. And then a final question on how, I think I lost that question, how tracing of something? Tracing of some of the persons who are being home managed. Is it true that there are some who cannot be traced? Okay, but there are a few questions for government from a policy point of view, so let me take that one. Computing data Komla, your question was on computing data about what? Yes. So the Ministry for Foreign Affairs is still going through that exercise. I'm sure you've seen letters from some of the missions to Ghanaians who had registered with the missions. We always encourage Ghanaians to register with the missions when you travel abroad. So the mission, some of the missions have sent out letters to Ghanaians who are registered with them. We notice that some of those letters are being interpreted to mean that there's an impending evacuation exercise, and it's already causing a bit of anxiety. Just to put it in context, the missions were asked to gather data on who is stranded outside the country so that you can even know the numbers and where they are and use that data as a basis for decision making. It's our understanding that I think by the end of this week, they will ferry in the data that they have collated. So maybe by the end of this week, we can have some more clarity on the numbers that they have gathered. But just to put it in context, that directive to the missions was to them to gather data. And so the interpretation that is coming across that there's an impending evacuation, I think it should be put in its right context. The TUC says that the 600 million Ghana cedis is not enough. Government agrees with that view. That's why we haven't limited it to 600 million Ghana cedis. The 600 million Ghana cedis is for small and micro enterprises. That is why the NBSSI is the one that is taking leadership in putting the arrangements together. You recall last week, Mrs. Kosi Yankee Aya was with us to explain what they had done. They came to the cabinet retreat to update us. They've been asked to do some adjustments, and hopefully before the end of this week, they will roll out the roadmap for it. But that is just for small and micro enterprises. You've heard the president talk about the Bank of Ghana and the commercial banks putting together some 3 billion Ghana cedis for other categories of businesses that are not in the small and micro space, including hotels and other industries that can tap into that credit line. Beyond that, I have also just mentioned to you that the minister responsible for finance is putting together a recovery plan. The president, if you followed his speech, described it as a resilience and recovery plan, which will also do with some fiscal expansion measures to help us inject some more money into sectors of the economy. So we don't disagree with the TUC, Selom, we don't disagree with the TUC. It is for that reason that we have various categories of this, and we're in the process of rolling them out. This recovery and resilience plan, or this resilience and recovery plan, has a broader scope, including the financial services sector. So questions about what is the plan today is part of what the finance minister is putting together based on the initial presentation and the feedback which he'll be outlining to the country after cabinet approval through parliament. I think those will be the questions I will take. Let me invite the doctors.
Thank you, Honorable Minister. I'll take some of the questions and provide some response. Frontline workers. Currently, we have grouped them into 3 core groups. There are those who are directly in part of the team managing COVID cases. And so that will be, so if you are, for example, driving at Gan East, definitely you are part of the team. We also have another group of those who are doing the surveillance, who are following them up, contact tracing, etc. They are all part of the next group of people who will be taken care of. We also have the group who are also doing the coordination, EOC, etc., doing the work in several lines across the program. And so that is the broad group that are also being taken care of. And if you talk about surveillance, that will include people who may be doing triaging, among other things, because you are there looking for cases. So those are the groups that currently we have as a team looking at that. On the issue of the mortuary, yes, autopsies, we know that some 2 autopsies have been done. We are yet to see the full report. Autopsy is not You can have the gross and also have the histology, so they will do all that. And once we have the report, we will see what we can learn from that. Because that's the main purpose of the autopsy, is to learn and improve case management. So that's what we'll be waiting for. Gene Expert. The rollout of Gene Expert has been part of the government program from day one. It was not an afterthought. It was not a suggestion from any lab group. It has always been part of the fact that we know that we have 130 Gene Expert machines in the country, and the plan is to upgrade 100 of them. Gene Expert machines were in short supply at the time, and I can speak here. A payment order has been issued for the cartridges to be brought in, including glove boxes that makes it safe to use for that. So we are expecting that in the next few days or so, we'll be able to upgrade about 50 of them for use. So it has always been part of government, the sector's response to expanding our capacity to do our labs. Our recovery rate, are we worried? Yes. There are different definitions for recovery rate. Ghana has probably the highest standard among the sub-region. That's what gives us the challenge. Ghana is doing 2 negatives. So if you are positive and you test negative, you have to get another negative to be able to be declared as recovered. There are 2 challenges that expands the duration of stay of people in care. And also, when people have tested negative, there's some reluctance in having the second test. And so, but there are other countries where they do 1 negative, and some of them, when you recover, you are discharged and declared as negative, not necessarily the laboratory negative. So if Ghana is to scale down our standards to, let's say, 1 negative, we will have a significant number. If in my presentation I told you that apart from the 494, we have 130 awaiting their second negative. There are some we are not being able to follow because they feel that I'm negative and I'm not ready to do another test. So that's what it is. And so we have a significant number of people who have, in practice, in theory, recovered. But based on our high standard of doing 2 consecutive negatives, it seems to keep our numbers down. We have done some assessment to see what the probability that someone who tested first negative will test positive again. The numbers are very, very insignificant, so we may consider revising our protocol. And if we do, we'll let Ghanaians know and let them know this is the new policy, maybe aligning with most of our neighbors who are just doing 1 negative. Home management. Yes, we visit. The definition to keep someone on home management is the fact that you do not have any comorbidity and you have a mild symptom or no symptom at all, and that is what we do. There are... That you can also have a facility that allows you to... Yes, you can also have a facility that allows you to isolate, and you have the space and discipline to self-isolate based on our own judgment that we do, not just with us, but also with the security agency to ensure that this thing is also no cause. Whatever, when you are positive, you are a threat to your neighbor and your family members. We visit them regularly. We call them. Yes, there are some that Greater Accra in particular has responded. They are difficult. They are unable to reach them. But looking at the duration of their condition, most are likely have recovered and do not have symptoms based on the other definitions that are necessary. So that is the issue. The recovery rate, we are taking a second look at it if we want to, but we might start reporting double negative and single negative and then see how we look at our recovery rate. So if we were to do that, we'll have a significantly high recovery rate that we are not reporting now. Thank you very much.
Colleagues, we will have to bring down the curtain at this time this morning. We want to tighten up the briefs as quickly as possible. So we thank you for your time. On Thursday morning, we will do well to start at 9 on the dot and give you the latest updates as we have it. But we continue to implore the Ghanaian population. The borders have been closed as a first line protection. The state can do that one for you, even while you have some who want to bring people through illegal routes. The military and the immigration continue to intercept those attempts. The state has also, by law, imposed restrictions on public gatherings, social gatherings, etc. The state can do that for you. But the personal preventive etiquette, the state cannot do that for you. We need everybody to take the personal preventive etiquette seriously. Social distancing is key. Wearing of the face mask when you're stepping out of your home is key. Washing of hands with soap and running water regularly is key. And in the absence of that, using the alcohol-based hand sanitizer. The state will do its best to support and to protect you, but you also need to do yours to complement that effort. We thank you, and we'll see you on Thursday.
And you're live on the JoyNews channel here on Multi TV, also live on DSTV, Go TV. We're streaming live on YouTube. That was our coverage of the Minister's press briefing on COVID-19. And we continue with the half-hour edition of News Desk here on JoyNews. And coming up in the next few minutes, Ghana's case count shoots up to 5,127 with 4,611 active cases. We also have 492 recoveries. We'll bring you the latest from that press briefing. Also, Kumasi records 307 new cases with 272 from Obuasi, making it the latest high-risk area for COVID-19 in the Ashanti region. Meanwhile, Information Minister assures government does not intend to extend its constitutional regime in the wake of the COVID-19 pandemic, explaining options are being explored for this year's elections to be conducted.
Government takes note of commentary suggesting that some possible governance arrangements can be appropriate should it become impossible to hold elections in December. But the government does not contemplate any justifiable reason to seek to extend its first-term constitutional mandate with the virus as an excuse without a safe, free and fair election. The government is of the view that instead of contemplating measures that are not envisaged in the Constitution, our best energies, our innovation, our creativity should be invested in exploring how a country like ours can have safe, free and fair elections. If countries like South Korea did it around the 15th of April, Mali did it on the 29th of March and I think 19th of April,